that we'll be covering today. Hi, everyone. Welcome to our Facebook Friday or Ask the Expert. Can you believe it? Time flies. It's the end of the week. We're just going to be touching base or educating ourselves on a very interesting topic. Today, I've got an amazing guest, I must say. We are joined by Judith Gordon Drake. So we'll be covering on when the bed becomes bigger, understanding gambling and its impact on mental health. So Judith is a registered clinical social worker and an addiction professional in private practice who works with individuals, couples, and families, supporting them through a range of challenges, including addiction and mental health concerns. She focuses on self-development and personal empowerment and is passionate about helping her clients achieve holistic wellness. As a conscientious and experienced therapist and a group facilitator, she provides the highest level of care and puts maximum effort into facilitating lasting positive change. Judith's professional and personal interests are working with in addiction and family addiction therapy. She works with individuals, including dual diagnosis clients, with couples where one or both partners are struggling with addiction and with families impacted by addiction. So her theoretical bases include cognitive behavioral therapy, person-centered approach, systems theory, strengthened-based approach, and self-esteem development approach. Judith's professional strengths include a wealth of life experience and previous corporate experience. She's also a treatment professional at the South African Responsible Gambling Foundation and a family support therapist at the Horton House Addiction and Mental Health Treatment. With that being a mouthful, welcome, Judith.
It certainly was, but thank you, Tabaka, for that very kind introduction.
Yeah, no, so today's topic is something that's really close, I would say close to my heart because I'm really passionate about, seeing our country struggling with gambling. So with that being said, our first question I want to find out from you is, when does gambling stop being entertainment and become a problem?
The big word in addiction, whatever your drug of choice, is consequences. So gambling stops being a game of or entertainment when consequences start presenting in the different areas of the gambler's life. So these include relationships with spouses and partners, family and friends, and then finances, which is a big consequence for gamblers, and possessions and property. Then there's mental health and self-esteem, and finally physical health. So it's when there is consequences in those areas.
Okay, which is very interesting that you mentioned that. So you mentioned a very interesting point, but I would like to find out more from you. What are some of the early warning signs that show that somebody is struggling with or is having a gambling addiction?
Well, this is a continuation of your first question because addiction is a progressive disease of loss. And the impacts of gambling on the different the different life areas of the gambler can be devastating and irreversible. So there are numerous warning signs that indicate that a person may have a potential gambling problem. So looking at the first one, it's loss of relationships, and that's with spouses or partners, family and friends. And this it also causes a loss of healthy family dynamics as the whole family system is impacted when there is an addict in the family. There is family anger towards the gambler as they lie and deceive. And then problem gamblers also tend to withdraw and they isolate from others and they avoid family events. So the first warning sign is loss of relationships. Then we move on to loss of finances. So it's loss of finances and sometimes employment. And that means financial problems affect the gambler and the family, as unpaid accounts cause a lack of basic necessities. And gamblers are regularly short of money, even though they earn a salary. And there are many gamblers who regularly gamble their whole salary every month. They accumulate debt by gambling, and they take out loans from financial situations and dangerous loan sharks. They ask for extended credit, and they borrow money from family and friends. So that's number 2, finances, the warning signs. And then we move on to loss of mental health. So this leads to a change in mood, elevated emotional stress, and suicidal thoughts. Problem gamblers, they're prone to higher rates of depression, panic and anxiety disorders, and many addicted gamblers will attempt suicide before seeking help. Addicted gamblers are also more likely to be simultaneously struggling with other addictions, such as drugs or alcohol, as well as possible criminality like fraud and theft. And then other red flags or warning signs, this is the 4th loss, is physical health. So this could include sleep disturbances, change in physical appearance, lack of self-care and neglect of personal hygiene. And then finally, another warning sign is an increase in the time spent gambling and unexplained absences from work and home.
You mentioned there is quite a lot of things, and funny enough, what you are explaining to me now, it's pretty much what we're getting on the course. When we get our callers reaching out to say, look, I've spent my last salary, I've just got paid today, and my whole money is gone. And you become surprised to say, how so? This would also lead me to my next question to you is, how does, seeing that, how have online gambling and betting apps changed the way people gamble today, especially among young people? Because we get that a lot when people say that I play through the phone. There's this, I think, without mentioning the name of the company, there's this red aeroplane, they keep speaking about that aeroplane. So how has that changed?
Okay. Well, you're talking about Aviator, which is an online gambling
Yes.
game. So
Yes, yes.
prior to 1997, gambling was actually illegal in South Africa. And the exception was horse racing betting. And then gambling legislation came, and the National Lotteries Act of 1997 was the first act, followed by the National Gambling Act 7 of 2004. And that's since been amended in 2018. So since the legislation of gambling in South Africa, there have been many developments in terms of the gambling industry. And these include, as you've just said, the growth in the number of gambling apps and games, which are faster and more enticing. And there's also been a growth in the number of legal gambling venues and online betting platforms. And then there's the growth of sports betting, which is also online gambling. So this rapid expansion is driven by smartphone accessibility, low data costs, and 24-hour availability. And unfortunately, it has resulted in the normalization of gambling within our society. And it's caused a growth in persons, families, and communities that potentially may be affected by problematic gambling behavior. But it has been recognized as a pandemic. And in response to the rapid rise in online betting, the government is considering stricter advertising rules, stronger age verification, and tighter licensing requirements to protect consumers.
So, having said what you said, Judith, I'm just thinking off the bat. We are mainly now struggling with substance abuse as well, where you see how more and more young people, are struggling with addiction to either alcohol or drugs. Now, from what you're saying, that this is now regarded as a pandemic. So now we're having a third element within an addiction pathway, where now we are losing our young people to, addiction of gambling. With that being said, when should someone seek professional help for gambling related problems?
So let me just find the.
No worries, no worries. I'm just thinking of this is sparked by what you're explaining to me as and you highlighting a very crucial fact that
Okay.
this is
So
becoming
when someone has to seek help is when they are displaying risk factor. They're displaying the warning signs or the risk factors associated with gambling. So there's no one factor that causes gambling or causes problem gambling. But there's various risk factors that contribute to a person becoming addicted. And these include the genetic makeup of the person, the potential predisposition toward their potential genetic predisposition towards obsessive compulsive and addictive behaviors. And then unresolved trauma and loss can contribute. I actually don't explained the warning signs already of when someone should display seek help because they are exhibiting these warning signs and the loss and the consequences in their life. But these are the contributing factors that can cause problem gambling. And there's no one single factor. So there is the genetic makeup, and then there's the unresolved trauma and loss, which is crucial in therapy, in gambling therapy to explore. And then there's the psychological characteristics. So there's dual diagnosis, which is co-occurring psychiatric disorders. And the addiction treatment centers are finding that that's become the norm, that patients being admitted for addiction treatment have dual diagnosis and co-occurring psychiatric disorders. And then there's medical conditions as well, and socio-environmental and socio-economic standing. So that influences the gambler's access and social exposure to gambling. And then there's an inability to change your current circumstances. So there's a lack of coping mechanisms. And you lose your coping mechanisms as your disease progresses. And finally, a contributing risk factor is gamblers often have false beliefs about themselves and life and the world. And they have gambling-related superstitions. And so this means that they gamble more than they can afford to lose.
Sure, that is a lot to take into consideration. And what I'm hearing from what I'm taking from this conversation is not just the person who's gambling, they don't just lose money, but there's a lot of things that they're losing. One is, their mental health gets affected. They lose relationships, like you was just saying. So I just want to maybe take it because we do have some questions from our audiences. They were just asking. Hence, I highlighted that this topic is quite a huge one. So I've got one question from the audience. The guy said, my wife keeps on telling me that she'll stop after one last bet, but she never does. Why is it so hard for her to stop?
So this audience question, his wife has probably developed a physical dependency on gambling. So physical dependency can occur with regular, daily or almost daily gambling use. And this occurs because the addictive behavior of gambling directly or indirectly targets the brain's reward system by flooding the circuit with dopamine. So now I'm addressing the neuroscience of addiction. And dopamine is a neurotransmitter present in regions of the brain that regulate movement, emotion, cognition, motivation, and reinforcement of rewarding behaviors. So when activated at normal levels, in a non-addict, the system rewards our natural behaviors. But overstimulating the system with gambling behavior produces effects which strongly reinforce the gambling, and it teaches the viewer's wife to repeat the gambling. And physical dependence can lead to urges and cravings to gamble to relieve the withdrawal symptoms. And so once his wife starts gambling, she cannot stop.
So what you saying, if I understand you correctly, is you're speaking about the dopamine system, which is our reward system, our pleasure-seeking system
And
for our
pleasure,
audiences
reward
that
and
are listening.
pleasure.
Yes, yes, yes. So when one is, for example, my pleasure is, having tea. So if I don't have tea, my dopamine system gets complicated. So in this, bringing back to the context of our conversation, you explaining that, if I understand you correct, the wife can't stop because of now the dopamine system has been overstimulated. Now they've
And
got this phone
hijacked.
and
The word
hijacked.
we
Oh,
use a lot is hijacked. So
okay.
the brain stops making natural dopamine, and then it
Mm.
has the urges and cravings for dopamine produced by gambling.
So this explains, because you would see quite often, when you're traveling and when you get the opportunity of using some public mode of transport, that people get on their phones, early in the morning, they just quickly on, these platforms. So this is even in, their surroundings, they're no longer aware. Am I understanding you correctly on this regard?
I'm afraid I'm losing you a little bit with the sound.
No, I was just saying that this now is just what you just mentioned, the hijacking, of
Yes.
the brain system is reminding me to, if you get the opportunity of being on a public mode of transport, you find people just early in the
Oh,
morning,
really?
they just on
Yes.
their phones, their betting,
That's
and this
right.
is one now, someone taking their silent conscious of their surroundings, which is quite interesting.
Yes. Yes. Well, as I was saying earlier, it's so easily accessible.
I'm so sorry about that, Judith. I think Devocho's network is down.
Okay.
But I think you guys were on question number 9, which talks about how can someone begin to rebuild their finances.
No, I haven't got that question.
Okay.
Hello?
So the next question is, how can someone begin rebuilding their finances, relationships, and emotional well-being during recovery?
So,
Deborah, you're back?
yes, I'm
Yes,
back.
yes, I'm back.
Okay.
Okay,
Okay.
perfect.
Well, I'm going to answer that question generally because addiction is a progressive disease of loss. And so the audience member has talked to the impact of gambling on his finances and relationships. And it can be absolutely devastating, these losses. So what I suggest is that they reach out for help and call the South African Responsible Gambling Foundation helpline for counseling and referral for treatment. And as Tebogo mentioned, I'm a treatment professional with the South African Responsible Gambling Foundation, which I'll refer to as the SARGF. And to tell you a little bit about their services, they have this helpline, which the person who's struggling with problem gambling can access. And then they also have the just going to get it here. They have professionally trained counselors who will take your call, and you need to be assessed on the helpline before you are referred to a treatment professional in your geographic area. And once you have created a therapeutic relationship with the treatment professional, that's when you have a cognitive assessment conducted to assess the extent of your problem gambling. It's an outpatient treatment program, and it's 8 weekly sessions for standard treatment. And in certain cases, there can be a referral to an inpatient treatment program after a psychiatric assessment. And then finally, the NRGP supports continued care, and they have a weekly online support group, which is held on a Saturday morning. So that would be my suggestion, that you reach out for help.
To the platform. And thank you so much for sharing that vital information.
I wonder if you'll be able to put the numbers onto your website for this help.
Definitely, we're gonna share. We're gonna share, and we do have responsible gambling as a referral on our platform. But we will share with our viewers. But leading to what you've just highlighted as well, I think the paramount question that would be on anyone's mind, from a loved one who's living with somebody who's struggling with addiction, for gambling.
I'm sorry, I'm losing you again. Can you repeat the question?
Would be, is gambling addiction possible, and what does the journey look like?
Right. And that is really a question that is,
is so often. Yes, the question is just
so often
leading to what you've just touched on, to say that these are the platforms that are available for counseling, and as a professional yourself, right?
Yes.
The question that would be on, is recovery possible? And how does it look like? How does the journey look like for some?
And this is a question that is asked all the time, because the recovery statistics can be very scary. So gambling addicts in recovery must take responsibility for their disease. And this means being honest about their addiction. It means taking responsibility for their past behaviors, being accountable for their treatment and recovery, and learning new skills to manage their condition and live differently. So I always use a quote by an American actor called Jason Bateman. And I really like his description of recovery. So he said, and he is obviously in recovery himself, and he said, recovery for me is not just about abstaining from gambling, alcohol, and drugs. It's about living a healthier, more authentic life. It's about being present and being accountable. So recovery means surrender. A gambling addict has to move from a culture of addiction where everything revolved around gambling into a culture of recovery where everything is focused, and the most important priority in his life is staying gambling free. So there are 3 stages of recovery, and the early stage is the first 12 months. And for long-term recovery, that is the most important stage where your focus has to be on staying in early recovery and doing continuing care for the first 12 months. After that, you go into stable recovery, which is year 2 to 5, and then sustainable recovery, which is 5 years and over. So I am trying to say that long-term recovery from gambling addiction is possible, but it's one day at a time. And I didn't mention when I was talking about reaching out for help, there's also the Gamblers Anonymous Fellowship, which problem gamblers can reach out to.
So that is powerful. That is powerful. I was not even aware that there's we learn every day. We never stop learning. But what I'm taking from this conversation is first we started saying that, gambling addiction is a loss. When you lose it, it's like somebody also who's grieving. Now, when we come to the healing part, it's also now speaking to the code that you just shared with us, that it's about the actual person who's struggling to take accountability. So these are the lessons that I'm drawing from this insightful conversation, that the responsibility, yes, the family can support, but now at the end of the day, the individual has to now take accountability and raise their hands and say, look, I'm struggling, I need help. And there's these platforms like the Responsible Gambling, organization, and counseling provided by yourselves and by the fellowship, which is something that's very key. I think our audience and listeners, are learning a lot, and I'm definitely learning. I'll be honest with you. It just gives me a different perspective
Yes.
from somebody who's struggling with gambling. I've never gambled before, so it's just giving me another world of the individual. So, with that being said, Judith, what would be your words of encouragement to the family members, just of the family members who are saying, "Look, I'm listening to this, webinar conversation that we're having, and I really want to support." I want to be that voice of reason to my family member or the actual person who might be watching us and is struggling with gambling. What would be your message of support or encouragement?
Well, this is important to me because I do family therapy with families affected by addiction and gambling addiction. So addiction is called the family disease. And addiction impacts on the family system and causes dysfunction. And it is normal to find parents and siblings and spouses and partners and children of addicts. They feel confused, frustrated, angry, and they feel helpless. So the everyday stress of living with addiction takes a toll on all family members, and that includes children. And it is physically, emotionally, socially, and spiritually. So recovery from addiction is about healing for the whole family. And so there is support available. Firstly, the SARGF run a family program, and they provide 3 counseling sessions for family members and loved ones affected by an addicted gambler. Then there are Gam-Anon meetings, which are the family self-help 12-step groups. The problem gambler would go to Gamblers Anonymous meetings, and the family members and loved ones can go to the Gam-Anon meeting. And those meetings are held physically and online. And then there are family support groups offered by addiction treatment centers, such as the one I facilitate. And there are many online family support groups, which a family member or loved one could research. And finally, there are other support groups for family members, such as faith-based groups, support groups. So a family member has to seek out education and guidance and to connect with other family members and loved ones of problem gamblers. In that way, they can gain knowledge and practical skills to support the addiction recovery process.
No, that is quite profound. And you know what you are mentioning, Judith, and I want to thank you. And also looking at, our time, this has been a very insightful, conversation that we're having. I could go on for hours with you. I think we could even speak, the whole day. But I want to take this opportunity to actually thank you for giving us your time. And we'll definitely, just want to share with the viewers that the session has been recorded and they can watch it again on our YouTube channel. And we'll also share the details for the Responsible Gambling organization.
Thank you.
And again, just, with that being said, thank you for being part of this conversation and for sharing your knowledge with us. Thank you so much, Judith. And I just want to give to the viewers that we do, if anyone is interested, because you were mentioning support groups, SADC is, having a training for support group leaders who want to start a support group in their communities. They can email supportgroups@anxiety.org.za. They can also get this information on our website, which is www.sadc.org, where they can get every information. But our support group leader training will be starting on the 27th of May, and it's a 6-week training, and you don't want to miss out. But I want to take this opportunity to thank you again, Judith, and thank you for your time.
It's been a pleasure. Thank you for inviting me to Bokro.
Thank you so much.